Hey, good morning, or I guess good afternoon. It's a little bit after 1 o'clock. We're just a little late getting started today. It's been a busy day with a lot of moving pieces and updates. My name is Tom Stolz. I'm the county manager, and I'm joined today by Chairman Pete Meitzner and the Director of Health, Adrian Byrne, and they will be speaking in a moment. First of all, let me give you the updated numbers that are fresh from KDHE. The number of confirmed cases in the United States has gone from 125,313 yesterday to 143,527 today, so an increase of about 18,000 cases nationally reported today. Number of confirmed cases in Kansas has gone from 261 yesterday to 319 today, so another 50 or 60 cases today in the state of Kansas. Number of confirmed deaths in the state of Kansas is 6, and we've had one in Sedgwick County, which Adrian will speak to in just a minute. Number of confirmed cases in Sedgwick County has increased from 41 yesterday to 48 today. The number of cases confirmed in periphery counties, Butler County at 3, Harvey County at 1, Reno County at 7, Sumner County at 1. Adrian, update from the Health Department.
Good afternoon. Thank you, Tom. Adrian Byrne, Sedgwick County Health Department Director. So as of noon today, Sedgwick County has a total of 48 confirmed COVID-19 cases. There are now tables on the Sedgwick County website with information related to all of those cases, and the table will be updated around 1 p.m. every day or as soon as we get information from Kansas Department of Health and Environment. As of noon today, we had 24 appointments scheduled for our clinic to take samples from to then send to the testing sites. If a resident or anyone has general questions about COVID-19 or believe that they may have come in contact with someone with symptoms or are ill themselves, they can call 211, United Way's 211, and they will answer the questions. And if someone is believing that maybe they were in contact with someone or have symptoms, they also are able to screen for that, and then we'll connect that person with our own nurse triage line if they need to be set up to have samples taken. As resources and supplies become available, we are still shooting to hold a larger scale drive-through than what we have right now, and that'll be to be able to test more of our residents. Once plans are in place, details will be shared. It's with our deepest sympathies that one of our residents has died connected to COVID-19. Passed away yesterday. He was a male over the age of 60 with underlying health conditions. Test results confirmed he had COVID-19 last week, and he was hospitalized. Chairman Meisner.
Thank you, Adrian. Good afternoon. Pete Meitzner, Sedgwick County Commission. As most of you may know, Governor Laura Kelly issued a executive order number 20-16, which established a statewide stay-at-home order. We understand it's pretty similar to ours and what Johnson County has done. This order was created for residents throughout the state to stay at home to help slow the spread of this virus. It took effect this morning, Monday, and it will be enforced until rescinded or until April 19th or until the statewide state of disaster emergency proclamation expires, and it can be reviewed and expanded or rescinded anytime between now and then. The governor's order does replace the current Sedgwick County stay-at-home order that we issued last week. Our counselor's office is reviewing the governor's order to see how it affects residents in any change of what you all have been used to so far. If the residents have any questions about the governor's order, please call 866-534-3463. That's 866-534-3463. Or you can email KEFF, Kansas EFF, at kansas.gov, or at ks.gov, sorry about that. I want to reemphasize that the stay-at-home order, we feel that a majority of our population is practicing it, but we really need people to stay away from each other. We continue to get reports that says maybe the surge will be somewhere around April 20th, 25th. The hospitals are preparing for a surge that might happen anywhere from April 17th to April to May 9th. And they are in great preparation to try to handle that. But in the meanwhile, we just need everybody to stay at home unless it's essential that you have to get out among. And maybe even to the point where just one of you go in the grocery store, you don't need to bring the whole family in. If one of you can do the groceries, then get it done and get out, and it goes with about everything that we've been trying to do. So I'll hand that back to Adrian.
ComCare has a new support line that's available for residents who are experiencing elevated mental health symptoms but in crisis. Residents can call 316-660-1111 from 7 a.m. to 7 p.m. Monday through Friday to receive resources, coping skill ideas, and encouragement to stay healthy emotionally and physically. KDHE testing is now considered positive. For the last, since Kansas has been tested, any test that has been positive was called a presumptive positive until they were confirmed through the Center for Disease Control. But now CDC is no longer doing that, and is because the positives here have been positive there. So they will no longer be called presumptive positive, they would just be positive.
Okay.
Just to reiterate, part of the message we've been putting out regarding donation requests, there is still a commodity shortage for our hospital workers and our first line EMS, police and fire correspondents. So if you are a business that would either like to support through donation, or if you can manufacture the following items, please get into contact with us, and I'll give you a number to call at the end of the list. We are short of protective face masks, which are N95 masks, and they have to be FDA or NIOSH certified masks. So those N95 masks, which have certification, and also surgical masks, we are short of. Non-latex medical gloves, surface cleaners, non-permeable fluid-resistant gowns, and nasal pharyngeal specimen collection, which is a swab and a viral transport medium. If you have those and would like to donate, or you know a supplier, or you can manufacture, please contact us, our emergency management, at 316-660-5959 to talk with a person in emergency management about acquiring that or what you have to offer. The media briefing that we are doing today, this video conferencing, will be our last. We will, every day at 1 o'clock, put out a information sheet which contains much of this same information, all of it in fact. That will start tomorrow. Updates, including new case counts, will be shared on the county's COVID-19 website. That's www.sedgwickcounty.org/COVID-19. And you can get that through our website. That I will say in conclusion, and Adrian can correct me, but the numbers, the cases are doing what we thought they would do. They are increasing. As the chairman mentioned, we had a discussion this morning with hospitals, Via Christi and Wesley staff. They are looking at a window of peak anywhere between the middle of April and the first week of May. They were adamant this morning in this conversation, and Commissioner Cruz was on this as well, along the chairman and Tim Kaufman and I. They were adamant that this stay-at-home order is so critical right now. So please use common sense, and whether it's a governor's order or a president's order or a county order, use common sense and please stay home and remain distancing from other people, because it's so critical for our medical system in the next 2 weeks that we keep this curve as flat as possible so that they can provide good health care for those that need it. Adrian will be featured at our county commission meeting at 9 o'clock on Wednesday morning to give an update from the health department with all of this kind of data and more. So please watch that and refer to that. And with that, anything else that we need to say?
No, you covered it.
Okay, very good. Everyone try to have a good day, stay safe, and stay home. Thank you.